but I wanted to welcome everybody here to this Q&A session, and just to sort of give you quick off the top here a sense of how we're going to be running things. This is a little bit of an experiment. In the past, we've done these as a webinar. So this is the first time we've done it as a meeting where people have their videos on so we can see everybody. So hopefully I might have a few technical difficulties, but I have you set to auto mute. And if you have a question, I believe that you can at the bottom there's an option to raise your hand. If there's something you want to say, or if you have there's the chat function. If you want to type a question in there or just say you have a question, feel free to do that. So yeah, that's how we're going to be running things off the bat here. And Linnea, I see. Oh, Linnea, did you have a question? No, you were just trying it out. Okay, I see. Okay, well, we're about 3 minutes in here, so I'll just sort of get things started. Thanks everybody for coming to this Q&A session. My name's Ben. I'm joined by, and I work at Phamily. We're a CCM solutions company. I'm joined by Stuart and Chantel and Julie, this is our third time doing one of these. We have some information to share about how best to do CCM, but we want this to be interactive. We're not good at lecturing, so we want to sort of take people's questions and sort of get a sense of what questions you have about CCM, and we want you all to get the most out of this. So as I said before, you can hit the raise hand function at any time if you have a question, and I'll unmute you, and we can do it that way. Or if you have a question, you can type it into the chat, and we'll see it there. So yeah, and then also I wanted to say I'm going to run a couple poll questions up on the screen. I'm just asking about people's familiarity with CCM and stuff at a certain point here. So that'll be another sort of housekeeping thing about how this is run. So my name's Ben. I'm a marketing manager here at Phamily. I'm helping to sort of moderate and run this Q&A session. But the real experts here are Stuart, Chantel, and Julie. Stuart, do you want to introduce yourself and talk about what you do and a little bit about your background?
Sure. Thanks, Ben. First of all, welcome everyone. It's great to have you join. My name is Stuart Tarnowski, and I'm an account executive. I work with clinics of all types throughout the country. I mean, everything from primary care, specialty, RHCs, FQHCs, small clinics to larger systems, all the way up to 99 providers. So I do a little bit of everything. I have been with Phamily now for just a little over a year. I look forward to, working with you guys today and answering some of your questions.
Thanks, Stuart. And next, Chantel, just because in my view, you're to my right.
No worries.
Do you want to
Sure.
talk about what you do at Phamily and a little bit about your background in the medical field?
Sure. Hi, everyone. As mentioned, I'm Chantel. I am a patient advocate here with Phamily. As far as my background, I am a certified medical assistant. I have been in the field for 12 years now. Basically, what I do at Phamily is I assist with those patients and clients that need to be enrolled for the program. So we send outreach text messages to all of our patients for our clients, but those that do not respond, we follow up with a follow-up phone call just to try to get those patients engaged into our system. And also regarding like the inbox management for Phamily, the patient advocates have the role on that as well. We assist with the clients and the care managers. I've only been with Phamily for a few months now, so I'm fairly new, but I'm enjoying it and I love everything that we have and that we do.
Oh, thanks, Chantel. And Julie, do you want to talk a little about your background in the medical field and what you do at Phamily?
Welcome, everybody. My name is Julie. Like as Chantel has said, I'm the same. I also am a patient advocate. I have a medical background as like for over 20 plus years in different specialties, clinics, all sorts of things. I'm a medical assistant as well. Been with Phamily. I think Chantel and I actually joined basically the same day. So we've been here a few months. Love it. It's a very great atmosphere. The people are just fantastic. So yeah, I mean, Chantel basically explained what we do. So I really don't need to add much onto that. She did a very good job of it. So welcome.
Thanks, Julie.
Yeah, absolutely. And thanks very much, Julie. And so I also want to hear a little bit from everybody here. We have a fair number of folks on, so looks like about 19 total. If you're able to, if folks could just type into the chat function there, like where you're from, where you're calling from today, what your role is, you know, what your job description is, and, you know, maybe what project you're working on in terms of CCM that brought you here today. So if folks want to type into the chat there, I can help shout it out. I'm not sure if everybody can see it or not, but I'll read it out if as people are doing it. So if you can type in there where you're coming from, and we'll just sort of get a sense of the geography that we have on this meeting today. Yeah, Randy says at a medical center as a clinical care coordinator and starting CCM enrollment and keeping up with enrollees. Stuart, who this is in Chicago, I knew that one, but not everyone else does. Stuart's coming in from Chicago. Sonia is Metro Community Health Centers and starting a CCM program. Sherry, an RM and CCM in primary care in Nashville. Awesome. Jennifer, or Jen and Christy from a family practice clinic, starting a new CCM program with 115 enrolled. Awesome.
Wow.
Yeah, wow. Practice success manager in Atlanta. That's Kayleen. So yeah, people from all over. Doug from North Carolina. It's a group that does a nursing home looking to start CCM. East Texas, looks like we got here. Pennsylvania, Orange County. Yay. Yeah, Chantel's coming from us from Pennsylvania as well.
Yeah.
Orange County, Carlos, who is his first day here at Phamily. He's listening in. I know who that is. And a coding consultant from a large Seattle hospital. That's Melody. So that's awesome. Thanks so much to everyone it's great to get a sense of where everybody's coming from. And it's kind of crazy to think how we do things now that we can have this meeting from all over the country. So I'm going to run a poll real quick, just to get a sense of how familiar everyone is with CCM. People said in the chat, but it just maybe gives us a sense so when we're answering the questions, we know, about a sense of where the audience is. So I'm launching this now. It should come up and it'll just say, how familiar are you with CCM? And just, answer the one that seems closest to you. And then I'll publish it, and that'll just help Stuart, Julie, and Chantel and me sort of, get a sense of where you guys all are with CCM. And we got mostly everyone's answered. A few more seconds here. Speak now or forever hold your peace. All right. So looks like we have 4 folks who are currently doing it, 4 folks who are planning to do CCM, and 3 who are just learning. So a good mix. It's really good. So I definitely want to open things up here next to questions. If folks want to, you can either type it into the chat if that's easier, but I think really the best way to do it is if you can press the raising your hand, or if you type it in the chat, I have a question, and I'll unmute you, and we can sort of take things from there. So who wants to go? Can we get a volunteer, sort of someone brave to go first with our sort of Q&A session here? And make sure that I know how this works in terms of how the The anybody have a question? I'm sort of looking around here. Want to talk about? We can sort of also go through a little bit of what we've seen in CCM challenges that we've seen in a lot of practices around the country. Doug, are you looking for the raise hand function? It sort of looks like you might be. Did you want to ask a question?
He said yes.
He said yes. Okay. There you go. You're unmuted, Doug.
Does your company have any experience with doing CCM in the nursing home environment?
Awesome. Thank you. Stuart,
Yes.
you want to take that one?
Yeah, so to be clear, are we talking about skilled nursing, long-term nursing?
Long-term nursing and also assisted living.
Assisted living, okay. So you can definitely do it for those. Just to kind of backtrack a little bit, the skilled nursing side, for anyone that might have a question there are challenges with doing CCM for skilled nursing because it's billed under Medicare Part A. And when it's billed as that, the only way you can really do CCM out of a skilled nursing home is when they're leaving. So kind of like transitioning and then maybe going to a long-term home or going home. And if you can kind of capture them there, then there's opportunity. But from your specific situation, yeah, it can absolutely be done. It's definitely a little bit different, right? So there's two parts to CCM. There's all the activities that the clinical team does on a day-to-day basis, right? And that's a long list of things, everything from like chart reviews, refilling medication, voicemails, referrals out to other doctors, et cetera, right? So that's the documentation aspect of things that are being done. The other half is the ongoing communication. Now it's a little different because it's in a nursing home, right? And you know where they're at essentially all the time. So sometimes I've seen that communicating with their children, kind of updating them there. Sometimes it's everything from checking with vitals, blood pressure, and all these sorts of things. So it can absolutely be done. I would say there's just a lot more workflows that are involved in a situation like that, and figuring out who all is going to essentially be running the program. And what I mean by that is compared to, say, a typical clinic, the providers usually are not that involved in CCM. It's the clinical staff. The only time the providers really get involved is when things need to be escalated up to a provider or an E&M visit is driven out of that. But when you're in a nursing home or an ALF, right, it's a lot of times all those nurses are going to be involved in the program because they're regularly meeting with the patients on a day-to-day basis. So yes, it can be done. I'd be happy to set up like a one-on-one to kind of like really dive into what that looks like for your clinic. But we do have some, not a lot, but we have some clients that are utilizing it through us.
Great. That cool. That's good. That's interesting to know. I hadn't really even known about how you would do CCM for nursing home. It's interesting to think about, updating maybe a guardian or children as part of that is sort of the phone calls that you can do, or in the case of what we do, more texting, which sort of brings me to Sonia's question here, which she typed into the chat. She asked, what are some of the tasks that can be used to credit for CCM billing? That's definitely sort of a big picture look at this. Chantel, do you want to talk about sort of like traditionally what a lot of people do for CCM billing, and also sort of what we've seen work well with some of our customers at Phamily?
Sure. So here with Phamily, we use a text-based system where we send out text messages to our patients. We call them check-ins. Most of our patients get about 2 check-ins a month for phone calls if they're manual patients only, and then they may get about 2 check-ins per week if they're text-based. So all of these things are counted towards like CCM billing, so to say. I'm really not too familiar as far as like what codes and things that would need to be used, but I know a lot of the outreaches that we do with our patients are considered billing aspects. Stuart, if you want to follow up in
I
regards
can
to
jump in
billing.
there. Yeah. So not just the billing part. I think part of the question was what are all the clinical activities that actually count towards CCM? The short answer is any non-face-to-face clinical activity that is done for the patient does count as CCM. I have a little list here. I'll just kind of rattle some of them off. Medication refills, prior auths, chart reviews, chart prep, chart updates, lab reviews, refills, medication refills, referrals out to other doctors, home health, ER follow-up, texts, calls, voicemails, right? Symptom management, a lot. And there's some that aren't even included on that. And then under billing, I mean, there are a multitude of codes when it comes to CCM, but the three main ones that you're going to see, unless you're in a rural healthcare center or an FQHC, they only have one billing code, and that's G0511, and it reimburses around $81.93. All other clinics, they're going to fall under G0506. That's a one-time billable code, which is tied to the patient being seen by the provider. And then the other two main codes are 99490 and 99439. 99490 is the original 20 minutes of bill time. And that's going to, I'm going to call it an average in the country right now of about $65 on the refund. It's going to vary state to state in some cities as well. And then there's additional something called complex CCM, which is an add-on code. So you can actually bill for the original 20 minutes and then complex on top of that. That's what the 99439 is.
Awesome. And and then I have a couple other questions that have rolled in here. And let me know any of our panelists here if you have a particular background in this. But Jennifer asks, if someone's on dialysis, can they be included in a CCM program?
So the technical answer is yes. And can they be included? As long as, so just kind of to go over the basic rules of being in a CCM program is they have to have 2+ chronic conditions. And by the way, that can include things like BHI, behavioral health integration. So maybe someone has depression and they have thyroidism. I said it wrong, but you get where I'm going with that. So diabetes and maybe they have depression, right? So it could be both of those. And then they also have to have a visit within the past 12 months. This does include right now, it could be an in-person visit or it could be a telehealth visit. Those are the two main criteria. So yes, could they be on dialysis? Absolutely. In fact, we work with a couple of nephrologists and so forth. But can dialysis itself count as CCM? That's kind of a gray area, right? Because they're being seen by the clinic in some capacity. It's all the other in-between work that the clinic does for the patient. And the idea is to do outgoing outreach, right? So for us, we are a text-based platform where we create content that is patient and condition specific, and then we send it out to the patients called check-ins, and we're engaging them about their health and asking them questions, giving them tips and so forth so that they can respond in. Other people will do a phone call based model and they're outreaching, right? But that's the two parts of CCM. So I don't think dialysis itself would count for CCM, but could someone on dialysis be involved in a CCM program? Absolutely.
Awesome. That's a really, really good perspective on it. I know that Stuart, you only have a few more minutes with us here. So maybe we'll try to cover other questions that might be in your wheelhouse in particular. Linnea has a question about reimbursement, about starting a CCM program. How long does it take to get reimbursement? In general, what does the typical reimbursement look like? A monthly payment, quarterly, et cetera?
Sure, good question. So the billing is done at the end of each month, or technically you could do it to start of next month, but each month is its own entity. So in March, right, it would go March 1st through, I think there's 31 days this month, right, through the 31st.
Yeah.
And right, it was a guess there. And then you bill for it, right? The reimbursements in terms of like how long they take to get back, I'm not exactly sure on that, but I'm guessing anywhere from like 1 to 2 weeks, maybe. Like whatever standard like reimbursements are for you guys is probably what you should expect there. And then what do typical reimbursements look like? So that's where things get a little hairy. And it really depends on the type of program that you put into place. To kind of high level here is the average care manager in the country, according to CMS, can manage 48 patients. With us, it's 500, right? So big difference. And where problems come in with CCM programs is often staffing, right? They'll get to, I think someone here said they had about 115 patients enrolled. That might be one care manager, that might be two. But as you try to scale the program, those are some of the challenges that come into play. And those are areas that we really try to help out. So it can vary. All I can tell you is from what we see, about every 500 patients enrolled with us nets a profit for our clients annually, somewhere around about 280 to 310,000.
Yeah. That's a really key number there when it comes to the reimbursements, and the scale there is that we've seen as that's possible with a sort of text-based platform that sort of manages texts and sort of sends them out in a way that is sort of scheduled and automated. Really helps, sort of with that ratio of the care for how many patients one staff member can handle. And so that kind of gets us to another question here, which is, if you send this is from Randy, but if you send a text, how do you bill the time? Does one text count as X minutes? And that's a question we get a lot about how that counts for asynchronous activity. Stuart, do you want to take that, or?
Yeah, I can jump in there. So we're a software company and a medical company. So for us, we've done lots and lots and lots of testing in terms of how do we get to those numbers. For us right now, it's about each text that's sent out is calculated out to about a minute. And if our clients send out 8 text messages a month, that's going to correlate to about 8 minutes just in terms of outreach. But then patients text back and so forth. And there's some nuances, but that's generally what we see. From our program, when you send out a text, we're also getting them enrolled. And so to get them enrolled, they're consenting to being a part of this sort of program. And that's a key part, right? You can't just willy-nilly sign up all your patients, right? First, they got to be a good fit in terms of like chronic conditions and so forth. And then they have to consent to be a part of the program. So that's key. So in terms of whether it's a phone call or a text-based model, we have tools internally that are essentially tracking these times and automatically doing this so that our clients don't have to do it. If you guys are looking into doing like, how do you track text yourself? You would have to look into some sort of solution that's probably going to help you do that. It would be difficult just to like send a text from your own phone and track like how many times you're able to track that.
Right. Yeah, absolutely. So there is a bit of a challenge there with tracking texts, but we do have a system for it, and that sort of does it in a more automated way. And but yeah, it is more of a challenge if you want to do it on your own. And also, but in our experience, audits happen. Medicare will audit. Our customers have always passed with flying colors, like, no issue in terms of tracking that time. So it is possible.
Real quick, Ben.
Yeah.
I do have a hard stop here in a few minutes. I know our team can stay on. There are 2 things that I wanted to, one question here, and then I saw Sherry actually said something earlier that I wanted to bring up.
Oh, sure.
the question here. Someone asked in terms of if a patient passes away. I was looking for it. Do you see that?
Yeah, I saw that one.
Oh, yeah. The question was if when a patient passes away, can you still bill for that previous month? Short answer is yes, so long as they hit the billable time. The next month, obviously, you want to pull them out of the system of the CCM program if they've passed away, unfortunately. But as long as they billed over the 20 minutes the previous month, then yes, you can absolutely bill for that. And then I don't mean to call out Sherry here, but I saw a comment from you. You said that you were moving from a CPC Plus over to CCM. There's a couple of things there because you're seeing a lot of movement there. CPC Plus is kind of essentially ending and also turning into a program called Primary Care First, PCF. So they kind of either have to move to that program or they have to go to a strictly CCM program. Sherry, did you have any specific questions there with that transition?
Sherry, I can here, Sherry, I'm gonna unmute you if you wanna ask yeah, we can hear you, Sherry. Do you wanna ask Stuart about it?
So can you hear me?
Yeah.
Yes.
I've been a chronic care manager for 3 years, and we were in CPC Plus. We did not opt to go to primary care first. We are implementing CCM on our own. I have looked at some of Phamily's information. I've looked at another company's information. I discussed this with my providers, and we're doing this on our own for now. It's going well. It's a lot of work because I am the only one really doing the implementation. We've done the staff training on all of the things that we do daily in the clinic that we can count, and the patients are receiving it well, but it's a lot of work since I'm the only person doing it. So we're going to see how it goes for kind of 6 months, see what the reimbursement looks like.
Mm-hmm.
We may go with something like you all in the future if this proves to be like we need to hire more care managers or go with a program like you guys. So we're just trying it on our own because I got some really good administrative backing as well as a strong team here, but we'll just see.
Okay.
Oh, sorry. Thank you for sharing that. I just want to kind of speak at a high level because some people may have looked at these programs in the past, CPC Plus, Primary Care First, CCM. What are the differences? The high level differences are if you are in a Primary Care First program right now, they look at what your patients are at the start of the year, and any patients that come into the clinic throughout the course of the year can't be enrolled in the program except for either quarterly or every 6 months, I believe. So there's some variation there in terms of the patients being enrolled, but they take an estimated amount of money and say, here's your reimbursement if you hit XYZ measures. So it's still a value-based care model, but there are certain things that you have to hit. I believe you also have to have a nurse under new 2022 rules for PCF. You have to either have a nurse in place overseeing the program or you have to hire one. So there are challenges in place, just like CCM, to get the reimbursements. But if you don't hit XYZ, then you don't get the reimbursements. Whereas CCM, you can continually add patients. Overall, if you're doing what you're supposed to be doing, the reimbursement should be higher through CCM. And I would say the overall, beyond just reimbursements in terms of the care that you're providing to patients, I've seen CCM care be better than CPC Plus when the clinics prioritize what CCM is, and it's not just a side project. And that's some key there to CCM. If it is just a little side project and not a lot of resources are being put to it, it is a difficult program to get off the ground and get running. But when you can see that from a reimbursement standpoint, CCM actually reimburses higher than most E&M visits across the country now. The question is, how do we move to a model that is going to drive excellent revenue for the clinic, but it can still, it's not something that's a burden on the clinic. And those are some of the challenges. I do have to run. I know the team can stay on. Thank you everyone for your time. I know we can set up one-on-ones after this if you guys would like, and I'll let Ben take it from here.
Yeah. Thanks, Stuart. I know you have another thing you have to get to, but I really think that what you just said is a good segue into maybe, and Sherry's question is a good segue into what Chantel and Julie do here at Phamily, talking about the challenges of getting so many people enrolled. One person at an organization in charge of all of it. What Chantel and Julie do here is at Phamily is help our customers with that enrollment process. So, Julie, we haven't heard from you yet. Do you want to talk a little bit about how that process goes and what you've seen help people out?
You mean like with like the slower enrollments and things like that?
Yeah.
Okay.
And yeah, getting people enrolled, getting the CCM off the ground, and sort of the challenges there, and what we've seen be effective at getting CCM up and running quickly.
Okay, so initially when we sent out those the texts to them, inviting them to join Connected Care, a lot of them will initially just start, immediately say yes or no or opt out, which is fine, and some just don't reply. And so we'll send 1 or 2 mass texts out to patients. And if they don't, then us as patient advocates, then we start calling, because a lot of times the patients don't understand what the program is all about, and or if they think scam text or something like that. And so we want to make sure we're there to very, clarify to them, put their mind at ease that we're not spamming them or trying to get any information out of them. And they do have a lot of questions about whether or not it's they're going to be billed, things like that. And yes, the patients that I have had most luck with are the ones that are Medicare based patients. They really enjoy the texting. Some patients don't have texting options, and that is totally fine as well. We work around that, and it's not a problem. But if they do decide, then all we have to do is just send them out another text to enroll them. And we explain what's going to be in that text, who their care manager is going to be, and that they will be in contact with them once they sign the consent in that text that we send to them. That a care manager will be in touch with them very shortly to kind of go over their health needs. If they have any more questions regarding the program. And that's kind of where that one stops. That's where it ends. Either they, yes, no, just not at this time, but basically that's how we get things going with them. And a lot of times they'll defer and say they need to talk to their husband or wife, and and we just put them down as a deferred. And a lot of times they'll just reply to that text. So that's kind of where we stand as when it starts slowing down after our initial text messages go out, then we do follow up with them. And so they know that there is actually somebody on the other line, and that this is truly a company that, that they could benefit from.
Absolutely. Yeah. Chantel, do you have anything to add to that, just about patient outreach and enrollment?
Not really. Julie pretty much summed everything up. One of the biggest benefits with having the patient advocates is that we are able to make those phone calls to patients, like Julie mentioned, because this really opens up like any misguided communication or any confusion that they may have about the program. I know a lot of patients think we're trying to sell them some insurance, and it's definitely not insurance at all. And then it also depends on, the rapport that the patients have with the clients. Because soon as you mention a specific doctor's name, you're calling in regards with that office. A lot of patients are totally on board for whatever their doctor is recommending, and they're appreciative to have, some sense of communication or a network after or in between their office visits, because there's a lot of times where patients leave the office with so many other questions and they're too ashamed to call into the office to get clarification. So that's one of the biggest things that Phamily has to bring, you know, for CCM management and
Right.
help
And
patients as a whole.
that texting, yeah, is just such an easier thing to do than put it on your to-do list to make a phone call to the office and then try to get through to someone and then talk.
Right.
So yeah,
And
that is.
also, I wanted to, also add in too, a lot of patients will say that they only see this doctor that we're calling from, what clinic we're calling from, once in a while, and that might be a specialist, and that they have a primary care and that they don't necessarily think might be beneficial for them. So if they had a question, they need to, we make sure that they understand that they can still message or call their care manager, and that care manager can absolutely be in touch with their primary care doctor. It's not specific to the specialist that we're calling from or one doctor that we're calling from. They can absolutely be in touch with any primary care doctor that they are seeing at one time.
Right. Because, and that's because they're signed up as their CCM, touch point. That's a really good point. So some people had to run. I know we were scheduled to end about 8 minutes ago. We're happy to stay on a little bit here and talk a little bit more if anybody has questions. There's a few more in the chat here that I think that we'll get to, and if not, we can follow up with you afterwards. Some folks I saw had questions about the billing code specifically. We do have a document about all the CCM billing codes. I can include. I'm going to send a follow-up email from this webinar. We'll have a video for everyone, and that will make it so that we can. You'll get the document and you can watch back the video. Melody has her hand raised. Melody, do you have a question?
Yeah, I just wanted to clarify with what Stuart mentioned about complex coding when he was referencing the
Right. Yeah, I saw your chat. Go ahead.
So 99499 is just for chronic care management, and the additional 99439 is an add-on code when 20 more minutes, and you can only bill you can bill 99490 and only allows you to bill the additional code 2 times per month. And then complex coding he didn't mention was for those more complex chronic care patients, 99487 and 99489. And I know somebody else was asking about the difference too. So
yeah, absolutely. That's a great point. And figuring out, especially when you're setting up a program, which are the add-on codes, how you can do all that, it's really important. And like I said, Stuart is better versed in that than I am, to be perfectly honest.
Awesome.
But as you can tell, we do have a document that's a little bit of a guide on that. And so, if anybody has, more in-depth questions on that, Stuart's always happy to do a one-on-one session with anybody if you want to just do a consultation with him. And I'll be sure to include in the email too a link if you you can pick a time on his calendar if you want to schedule something with him to talk about that. So thank you, Melody. That's a really good point, and I think that's.
No, I think a lot of times things get lost on these videos. He knows what he's talking about. I just didn't want anybody to
right, bill something based on that.
Yeah,
I know. Yeah, it's a very good point. We want to make sure that everybody walks away, better informed. So really appreciate your expertise on that, because the billing stuff is obviously super important, and obviously one of the biggest challenges when it comes to the CCM programs, especially when you're just starting. So I have a couple other questions here that maybe I can address, and maybe Chantel and Julie, you'd have some input on, but Sonia did say in here about she has a CCM template in her EHR, and talking about how to document that. So we have folks that we talk to all the time that they have a module in their EHR that does CCM. In terms of it, it's not no module that I've ever seen in an EHR is full service, and sort of lays out everything you need to do. It's really just a document, something that helps you document for when you are, for your billing and other things. And that sort of relates to another question that someone had about template care plans, which I think is probably the biggest challenge when it comes to trying to use the EHR, is that you still have to develop a care plan, which is, you know, with the patient. Our system at Phamily that we've developed, we basically have template care plans where there's just like a list of every, you know, chronic condition, and you can select, you know, the chronic conditions that the patient has. And then it's sort of auto produces a template care plan that you can then edit. And that documentation is really important for billing and such. And I've never seen an EHR module that does that. So, you know, sort of to answer your question, you do still need a care plan on top of documenting and what you're doing for your time. So yeah, that just to sort of address that, and to Emma's question about template care plans. You know, we do have a system for generating template care plans based on the conditions that the patients have. I don't know, do in terms of care plans, Chantel or Julie, do either of you guys work with those when you're enrolling patients?
So we don't work with the care plans directly, but as we're monitoring the inbox, we can see the messages that go out to the patients, because the patients would then respond. So for example, a care plan, like a message would be like, on a scale of 1 to 10, how are you doing today? Or if someone has sleep apnea, how frequently are you cleaning your machine? Or if someone has like diet issues. So each of the templates, I'm not really sure if they're called care plan templates or however you want to word them, they are personalized to the patient's specific needs. You're not just randomly asking patients random questions. They're all personalized to the patient's specific condition. So that's like one of the, yeah, that's one of the best aspects that we have with our Phamily software. And also in regards to Emma's questions, I believe as far as auditing, our system does the auditing as well. We have a very neat system that pretty much does everything for us.
Right. Yeah. Yeah. And we've always done, yeah, as you say, we've always done very well with any kind of auditing. So, you know, you got to have the care plan in place. You got to have the right documentation. And so we try to make that as automated as possible. And then in terms of doing it yourself, you know, that's a little more complex, but it certainly can be done at a certain volume of patients. So we're 15 minutes over time here for what we scheduled. I'm just gonna real quick show, we had so many great questions that we didn't really need to show this presentation that I have, because, you know, sometimes I have this ready to just talk about challenges, maybe spur people on to questions. But I just wanted to show people this because I'm going to send, as I said, I'm going to send a follow-up email after this, and I'm going to send that around to everybody. And I'll include this as well. But this is just, you know, in terms of if you have a CCM program that you're doing right now, if you're trying to get one off the ground, these are the biggest roadblocks and challenges that we've seen, which are the speed, which is how fast you can get people enrolled. And, you know, we were sort of talking about this one with Chantel and Julie, but, you know, setting a target, like looking at your eligible population of patients, setting a target for how many you want to enroll in a certain amount of time. You know, that's what they work on every day in terms of helping all of our customers meet their goals. And we definitely recommend that as a strategy for getting it off the ground, is taking a look at all of the eligible patients you have, you know, coming up with a plan and strategy to enroll them, setting a deadline, and then, you know, trying to meet it. In terms of scale, Stuart talked about that a little bit. You know, the sort of like CCM as a side project for just one person, one staff member who, you know, only has so much time to dedicate it. Not the best way that we've seen to do it. And often leads to issues with this, with the next point, which is sustainability, which is, even if you can get it off the ground, can patients stay engaged? Will they continue to respond and get those check-ins that are so important for billing time, but also for their care, which is the fourth point, which is quality. Like, CCM is designed to improve quality of care first and foremost, by keeping a close connection between the provider and the patient. So, that's another challenge that we see people. It's just like, oh, we're doing CCM, we're billing for it, but is it actually improving the quality of care for our patients? And so overcoming all of those challenges is definitely are what we hear about the most. And in this presentation here, a little more detail outlining the challenge and what we've seen as sort of, some general solutions. Obviously, here at Phamily, we try to follow those, what we view as the best solutions, but this is also just kind of like general good practice. So I'll send this around to everybody. I just sort of wanted to show it for the folks that are still here, so that you would know that it's coming and see that. So yeah, unless anybody has any more questions that they want to ask on the way out the door here, I'll give you a couple more seconds just to look around. We still have looks like 10 folks here, but I want to thank everybody for coming. Once again, this is our third one of these. We want to try to do these Q&As and sort of offer a space for folks to come ask questions about CCM, and because we know that there aren't a ton of informational resources out there. So we just want to sort of offer this as a standing thing. We're going to try to do it every week as often as we can, and have different folks from Phamily who deal with CCM every day coming in. So if folks want to attend in the future, we'll have more, and I'll send around a recording, all the assets, and everything to everyone. So thanks, Julie and Chantel, for joining us.
Yeah.
And thanks to
everyone.
everyone. Yeah, thanks
Have a good
everyone.
day.
Yeah, have a good day. Bye.